Well, good afternoon and welcome, friends, to our latest edition of the biweekly COVID-19 situation report on this lovely sunny November day. Thank you so much for joining us. Pleased to have several reporters with us today, and our acting medical officer of health, Dr. Ian Gemmell, our board chair, Mayor Andy Mitchell, and Donna Cherapy will be joining us, as well as our incident commander for the COVID emergency response. So to get underway, let's start with a chance to reflect on this beautiful place we call home. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, including Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. All right, so now I'd like to invite our board chair, Mayor Andy Mitchell, to kick us off with some opening remarks. Please go ahead, Andy.
Thanks, Brittany. In the last 2 weeks, the province has announced changes in both public health measures and vaccines. Because of the hard work and sacrifices of our residents, we are now able to cautiously exit stage 3. Thank you for your efforts to keep us all safe. And thank you to the men and women of public health and other healthcare professionals for their extraordinary efforts. The province has relaxed capacity limits in settings where vaccine verification is taking place. It has also relaxed capacity limits in certain other settings where venues introduce vaccine verification. It is important to remember that active screening and recording contact information remains requirements. Please be patient as these processes take place and vaccine verification is completed. The need to wear a face covering remains a requirement for indoor settings and outdoors where a physical distance of 2 meters cannot be maintained. Very importantly, if you feel ill, please stay home and get tested. The province also, just yesterday, announced an expanded strategy for third doses or booster shots, where it has been 6 months since your second dose. Generally, eligible populations include healthcare workers and caregivers in certain congregate living settings, those who received 2 doses of AstraZeneca or a single dose of Janssen, Indigenous adults and their non-Indigenous households, adults aged 70 and older. Later, eligibility will be rolled out to the wider Ontario population. This is a critical time for public health. Many other jurisdictions that eased restrictions saw an increase in new cases, and in some areas, a dramatic increase. The success of relaxed measures depend on high vaccination rates amongst the entire population. Please, if you are eligible, get vaccinated. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Andy, and thank you for picking up on some of the key themes that we'll be exploring later in our remarks. So for now, though, let's have a look at the numbers, and I'll invite Donna Cherapy to walk us through these next few slides with the latest data from our COVID tracker. Go ahead, Donna.
Good afternoon, everyone. So just to start, as of yesterday at 4 p.m., looking over the past 2 weeks, our numbers continue to show some improvements. Presently, there are 12 active cases in the community and only 36 high-risk contacts or close contacts. 2 weeks ago, we were following 132 close contacts, and that was largely due to cases connected to local schools, and this has since reduced. Unfortunately, as has already been noted in the media, we are reporting another local death caused by COVID-19 in a gentleman in his 70s who was unvaccinated. This sadly brings our total to 24 lives lost to the virus locally, and our sincere condolences go out to the family. Next slide, please. So when we look at cases reported on a weekly basis, we can see that last week was the first time since August 9th that we had case counts in the single digits again. And then this is particularly encouraging now that we are well into the school year. The low weekly case counts last month reflect how important the layering of public health measures is in preventing the spread of the virus. It is the combination of the individuals who chose to vaccinate, wear a mask, and physically distance, along with community measures such as proof of vaccination in high-risk transmission settings, workplace vaccine mandates, and capacity limits that have enabled us to achieve this improved situation. And this slide shows you the age groups of newly reported cases since the 1st of October. And we continue to see a higher proportion of cases among those under 20 years of age. And this is not surprising, as those are under 12 still are unvaccinated. And we are keen to begin or to offer vaccination to this population as soon as that becomes authorized by Health Canada. And in the meantime, remind residents to be extra vigilant in wearing masks, washing their hands, and staying 2 meters apart, especially when around our youth. Yesterday, we declared the one school break outbreak over. However, a new workplace has just been declared in outbreak today. So this status will change to one active COVID outbreak in the community within the city of Peterborough. And the map here shows you Peterborough's case incident rate over the past 14 days as it compares to the rest of the province. And starting on the right hand side of the slide, you can see the weekly case incidence rates. And for the period ending October 30th, it decreased to 6.8 per 100,000, which is down from 12.2 cases per 100,000 2 weeks ago. And the provincial rate is at 16.9 cases per 100,000 over the same period. On the next slide, these maps show the same information from October 19th and November 2nd. So you can see the change in case incident rates over the past 14 days across the southern part of the province. And it's great to see our region in green when compared to 2 weeks ago, along with more regions of the province. As far as wastewater surveillance goes, this graph does show the recent data from our wastewater surveillance system that we have in partnership with Trent University. And you'll notice that Lakefield's wastewater system is now included. The blue bar shows Lakefield's data, and the red bar Millbrook, and the green bar Peterborough's data. And you can see a recent signal has been detected in the Lakefield and Peterborough systems, and we will be closely monitoring this in the immediate future. Now turning to vaccinations, we can see here the current vaccination data as of the end of yesterday's clinics. And starting with our youth rates on the left-hand side of the slide, you can see that now 86.5% of those age 12 to 17 have received their first dose, and that 80% of youth have received both doses. And this means that the percentage of fully vaccinated youth has increased 2% from 2 weeks ago. And this contributes to the low number of cases in secondary schools in our region. So our sincere thanks to all local adolescents or teenagers for doing their part in keeping your schools safe. And the right-hand side of the chart shows the proportion of eligible residents, that is residents over the age of 12, who have received the vaccine. And these rates have increased somewhat over the past 2 weeks, and now 86.8% have one dose and 83.6% have received both doses. And so the first dose rates have gone up 0.8% and second dose rates have increased by 1.3% over the past 2 weeks. And we continue to run the walk-in clinics at the Healthy Planet Arena and have increased them to 5 days per week starting next week. And it's really to accommodate the demand for the booster doses. And Dr. Gemmell will provide some more details about the booster doses shortly. And just for your information, today the provincial GoVax bus is out in Havelock and Norwood. So please visit our website for regular updates on clinics throughout the city and county. And remember that many local pharmacies continue to offer vaccines as well. Thank you.
Thank you so much, Donna. All right, so Dr. Gemmell, you're up if you've got a few comments to share with us, and I will spotlight you on the screen.
Well, thanks, Brittany, and thank you, Donna, for this comprehensive overview of the current situation with coronavirus in the Peterborough area. I just have to say, I'm so happy to see things really in such a good state with a decrease in the number of cases. It's really a tribute to the efforts that not only are all the health professionals making, public health people, and so on, but also to our population who is getting immunized, because this is what is going to keep the rates of coronavirus down. If that virus has fewer places to go, it's not going to be able to circulate, and we'll be in a better situation. Anyway, today I would like to focus my remarks on yesterday's provincial announcement by Dr. Moore, the Chief Medical Officer of Health for Ontario, in which he described the expansion of the access to booster doses of coronavirus vaccine over the next little while. I'll start by talking about who is eligible, and then I'll touch on how those residents can receive the vaccine. So these booster shots are being offered based on evidence to those who are at greatest risk of severe illness if they happen to be exposed to and become infected with coronavirus. It's not a reflection of any concerns regarding the effectiveness of any of the vaccines against coronavirus. We know that Pfizer's, Moderna's, AstraZeneca's, and Janssen's vaccines all are very safe and they're very potent vaccines. We know that they provide powerful and persistent protection against coronavirus in most people who receive them. However, to protect our most vulnerable populations in whom the vaccine protection may begin to wane over time, the province is making booster shots available to the following groups. I actually have heard about them from Mayor Mitchell at the top of the media session, but I will repeat them. And also for those who care for them. So as Mayor Mitchell mentioned, the vaccine will be available to individuals aged 70 and over, to healthcare workers and essential caregivers in congregate settings like long-term care homes, retirement home staff, and their designated caregivers. Individuals who received 2 doses of the AstraZeneca vaccine or 1 dose of the Janssen vaccine. And this is because the mechanism of action of these 2 vaccines is different than the mRNA vaccines. And while they do provide some protection, pretty darn good protection against coronavirus, we do know now that a boost with the mRNA virus will make these vaccines even more effective. And that's why the booster doses are being offered to people who have received AstraZeneca vaccine exclusively, or to those who have received a dose of the Janssen vaccine. And finally, of course, to First Nation, Inuit, and Métis adults and their household members who are not Indigenous. Those who are already deemed eligible, such as those living in long-term care homes and resident retirement residents, remain eligible for a booster shot. And I'm pleased to share that the administration of the 3rd dose to these groups is well underway in our community. And by next week, all residents of long-term care and retirement residences will have been offered a booster. So we're making really good progress in continuing to cement the protection that is being offered to the most vulnerable and to the entire population. These booster shots offer an added layer of protection to the 2 doses of the vaccine that these folks have already received. And that provides, again, powerful, persistent protection. So there's no rush to get the 3rd dose, but there certainly is added benefit to those people who became eligible for a third dose as of yesterday. To receive the booster shot, we have reactivated Peterborough Public Health's participation in the provincial booking system. And that's really the end of my comments, but I just want to check with Brittany. Is Donna going to then be making some comments about how the clinics are being run? Is that where we're going?
Yes. Yep, I
Thank
think
you very much,
Donna's available.
everybody. Thank you very much, everybody, and over to Donna.
Yeah, thank you, Dr. Gemmell. So to support residents who want to get the booster shot, we are once again participating in the provincial booking system. And just like before, appointments you will be able to book them either online, and the link is on our website, or by calling the 1-833-943-3900 number, which will also be listed on our website. So one of the advantages of resuming the booked appointments is that it avoids lineups, and that's especially important for those who have mobility problems or older populations, and it can really help with those lineups are not that effective for that population, so the booking appointments will help avoid issues that come out of a walk-in clinic format. And we want to make sure that everybody can be vaccinated as quickly as possible upon arrival. And it also helps avoid standing outside in probably inclement weather that will be arriving soon. So the provincial booking system will be ready to accept appointments for the Peterborough area starting on Monday. So you will be able to go online on Monday and book your appointment, but the appointments themselves will be available Tuesday, November the 8th. So the Healthy Planet Arena will once again be a great visiting place for all of our residents who are eligible for the booster dose. So to find out when and where we are offering vaccination clinics, please visit our website. And those who are still interested in getting their first or second dose of COVID-19 vaccines can still walk into our clinics, and both Pfizer and Moderna vaccines will continue to be available. So those who are eligible for third doses, such as residents taking certain medications known to suppress their immune system, can also continue to walk in with either their prescription or a referral form completed by their family physician. And just before I hand it back over to Brittany, I wanted to touch on another recent provincial announcement regarding COVID-19 testing in schools. And we welcome the options for COVID-19 testing in schools announced last week by the Ontario government, and our school health team is working closely with all of our district school boards and our neighboring local public health agencies to ensure that we are implementing and rolling this out in a consistent way. The new access to Test to Stay rapid antigen screening for school communities will help prevent whole school dismissals and school closures. And we know how critical it is for students to be in schools. It's important to understand that the Test to Stay rapid antigen testing will not change any requirements for school cohorts with a COVID-19 exposure to self-isolate for 10 days from following the exposure. This testing option will support understanding of transmission outside of known cohorts. It is only available for asymptomatic, unvaccinated students who are not identified as close contacts. And there will be a requirement for 60% participation by participating cohorts and completion of 5 tests with reporting of results. And then students with negative results will be allowed to attend school. If a student tests positive, they have to stay home and get a PCR test as soon as possible to confirm the result. We know that access to timely testing has been a barrier in our community at times, and just like to really thank our testing partners at PRHC, the COVID Assessment Center, including the PRH staff, PRHC staff and the Peterborough County City paramedics and local physicians who are available 7 days a week for testing and assessments. Testing is critical for school communities to be able to break transmission of the COVID-19. The availability of PCR self-collection tests through our local schools is going to support easier access to testing and reduce barriers. This approach has been piloted across Ontario with success, and we anticipate that by mid-November, schools will receive shipments of take-home PCR self-collection test kits. When cohorts are dismissed because of school exposure, families and school staff will have access to these PCR tests to make testing recommendations easier to comply with. As well, students who are symptomatic will also be able to use these tests rather than seeking testing at a COVID-19 testing assessment center. And we are waiting further information about where community drop-off sites will be located and share this information with school communities once that becomes available. So thank you, and back to you, Brittany.
Thank you so much, Donna. Okay, and just to clarify, and this was my error. I had a typo in Donna's notes that the appointments for the booster shots, they will start on Tuesday, November 9th, but booking for them will begin on Monday, November 8th. So just want to make sure everybody got that information. Okay, so let's hear from our reporters who are on the line, and I suggest we'll start with our partners from Global. So we've got Katrina Squazin here with us. And just so everybody knows, we do have representatives from our local OPP detachment, as well as Peterborough Police, as well as Julie Ingram, our very own manager of environmental health, who handles public health inspections and enforcement. So Katrina, if you've got some questions for our speakers, go right ahead. Maybe she's stepped away. Okay, why don't we move over to Matt Latour, and we can come back to Katrina in a bit. So Matt, if you've got some questions for our speakers today, please go right ahead.
Yeah, my questions today are for Dr. Gamal, and they have to do with the booster shot. So I know there's a lot of talk when the vaccines were first starting to be rolled out about the effectiveness percentage, in the 90 percentile after the second shot. Do you know what that percentile looks like, 6 months afterwards, and what it gets boosted up to with the booster shot?
So thanks, Matt, for the question. I don't know if you had a chance to watch Dr. Moore's press conference yesterday. Basically, what he said, and what I'm going to repeat for you, is that they are watching, and this is kind of difficult because it really means looking at a number of parameters, how many cases there are in the immunized population, and there will be a few because the vaccine is not 100% effective. We know it's 90 to 95% effective, at least the mRNA vaccines. We would expect that there may be some vaccine failures. That does happen, even though this is a amazing vaccine that was developed so quickly. Then, of course, the other thing that has to be done is to look at people who have had the vaccine and to measure their antibody levels. That will give us an indication of whether the antibody levels are being sustained, whether they're waning. And then even if they're waning, that doesn't necessarily mean they reach the critical point at which they become susceptible. And that's called a secondary vaccine failure. It's primary vaccine failure is when the vaccine doesn't work. The secondary one is when it wanes over time. We haven't got those kind of details yet, but we do know that certain populations don't mount the same kind of response initially, such as people with certain chronic medical conditions, elderly people, and so on. So this is why these people are being targeted. I'm sorry I don't have exact numbers to give you, but all of this to say that my understanding is that 2 doses of vaccine in a younger, healthy person is providing great protection. And as a precaution for those people who are older or medically compromised, because we know that the vaccine can begin to wane, We know that natural immunity to coronavirus can wane over time. That this is being monitored, and that's why, as a precautionary measure, the boosters are being rolled out. And as you heard Dr. Moore say yesterday as well, again, to give the best possible protection and to blanket ourselves as a population with protection so that the virus can't circulate, boosters will be available in the future for the rest of the population. And that is yes, it helps individuals, but what it really does is it really helps the population, because if they're protected, this virus has nowhere to go. And that's what we want. Thanks, Matt.
And with the booster shot, I know a lot of people after their second dose, it kind of knocked them out of commission for, a day, sometimes two. Are there similar side effects with the booster shot, or is your body more used to it by then?
Well, that's a good question. And I haven't had any reports yet of any, how should we say, I review all the any adverse event that may be associated in time with the coronavirus vaccines. I haven't seen too many of these come along, although we have just gotten started, as I mentioned, in the long-term care homes and the retirement homes. I would say that people who are receiving this vaccine should expect to have similar types of reactions to their first and second doses, just because if you do that and you take the measures, for example, to make sure you rest the next day or whatever, then you're not going to end up trying to do 1,000 things while you're not feeling too well. It is possible, however, that the third dose, and this remains to be seen, of course, Matt, that it may well be that with the third dose, and we see this with other vaccines, that you get the stimulus, but our immune systems are already ready. They've seen this antigen before, and they know what to do. They're not waiting around to sort of go through a whole process of developing antibody. The antibody is in the storehouse and is ready to go to address that vaccine, the antigen that's in that vaccine. So it may well be, and as I said, it remains to be seen, that people may actually have fewer side effects. Just be prepared. And what I advise friends, family, and others is just take it easy the next day, because you don't want to be trying to do 1,000 things when you're feeling, slightly punk because you've had the chance to have this good protection. Thanks.
Perfect. And my last question has to do with proof of vaccination. I know that right now for proof of vaccination, you don't need a booster shot. Do you think that's something that should be in place or that will be in place down the road?
Well, first of all, should it be in place? I don't think it's needed at this point in time. I think that for the preponderance of the population, the vaccines that have been provided, 2 doses of them, provide such good protection that we are really confident that it's going to reduce the risk significantly. This is all about risk management and risk reduction. So I think the system, I applaud the system. I can't imagine the amount of work it's been to get this QR system out like this, so that we can assure people who are going out to public places that they are there and not going to be exposed to the part of the population, i.e. unimmunized, that is at much, much higher risk for carrying this infection. So I think it's a good thing to have in place. And I think that 2 doses at this point in time is sufficient. The answer to your other question, could it come in the future? Anything's possible. I'm hoping that maybe by the time we get to that decision point, we won't even need the QR system anymore, because we will have so many people immunized, including the younger kids who are coming up for immunization either later this year or early next year, that we'll have such a preponderance of the population immune that this virus won't be circulating much and it won't be necessary. But if this is all speculation, Matt, remains to be seen. I think that the only thing we can do actually is watch and wait and keep a close eye on what's going on with the epidemiology, the incidence of this disease, so we can make good decisions about keeping the population as healthy as possible. Thanks.
Perfect. Thank you, Dr. Gemmell. Have a good weekend.
You too.
Thank you very much, Matt. Okay, let's turn it over to Taylor Clydesdale from Peterborough This Week. If you've got some questions for our speakers today, Taylor, please go right ahead. Nice to have you here.
Thank you. Can you hear me all right?
Yeah, you sound fine.
Okay, perfect. I suppose this is a question for Dr. Gemmell, just in regards to the death. Do we know how long it's been since the last time we've had a death in the community, in the region?
I think I might actually defer to Donna on this because she's has these things at her fingertips. I think it was in September, if I'm not mistaken. But before Donna comments, just to say that I did review. We've had 24 deaths in, I think, a little over 1,000 confirmed cases in the area. This is works out to a how should we say, a percentage of cases that have died of 1.25%. And while every death is a horrible event for the family and friends and so on, the only silver lining we can see to this cloud is that this percentage is as low or lower than many other places that you might want to look at. So that's the only really good thing we can say about it. But as far as the last death is concerned, I will ask Donna for her help on that one to get the exact date and time.
I don't know the exact date and time, but I do know that it was in September, within the first 2 weeks of September.
Okay.
No.
I can get back to you on the exact date later, if that would be helpful.
Okay, September is probably a good enough time frame. Given that we are kind of in the 80s, or in the, you know, given that more than 80% of the population is double vaxxed at this point, what is the expectation for potential future deaths? Is it expected that, you know, we're going to continue to see some level of deaths despite the high level of vaccination?
Sorry, I didn't catch you. Is Tyler?
Okay, sorry. Can you hear me all right?
Yeah, sorry. Is it Tyler who's speaking?
It's Taylor.
Taylor, thanks for the question, and I think that it's a very good question because I think we want to know what we can expect from having a double vaccinated population. And the first thing we know for sure is that the cases are down, and that when cases do occur, they are predominantly in the population who are unvaccinated. To me, that's an extremely good reason for people who are yet to have their first and second doses to come forward, because they're the ones who really truly are at risk. As far as deaths are concerned, we are doing our very level best again to reduce the risk of illness and of complications and of death in the entire population through both immunization and the public health measures that are in place, including the case and contact management. But inevitably, deaths do occur. There are vulnerable people who may not be protected and who may have unfortunate exposure to somebody for whatever reason to coronavirus. Just think about influenza, for example. We get our annual influenza vaccine, and please, if you can include that in your story, that'd be great to remind people. It's really important to get their annual influenza vaccine this year because we expect there's going to be more influenza based on what happened in the Southern Hemisphere during their winter, which has just ended. But with influenza, we know that even with immunizing so many people, we still experience a few thousand deaths every year from influenza in an average year. So I think that even when coronavirus becomes endemic, it is still possible that some people who are highly vulnerable, who are exposed and become infected, will develop complications or may even die into the future as this becomes, as Dr. Moore describes it, more of an endemic disease, one that's kind of just around like a normal winter's virus. We do our very level best to reduce that risk, and I think it's up to everybody to do the things that they need to do, like getting immunized to protect others, like following the other public health measures of distancing and masks and so on, like, as Mayor Mitchell said, staying home when they're sick. I think these are all things that are going to be part of our modus vivendi from now on. But I'm certain that vaccines are going to reduce the deaths because they've reduced the cases, and the fewer cases there are, the fewer deaths there will be. But will they eliminate them? I think that is something that still remains to be seen. It would be my hope that this could happen, but based on our experience with other viruses, there still will be some vulnerable people who die of this and many other respiratory viruses that we circulate every winter. Thank you, Taylor.
Well, thank you very much for that. Just moving on to the winter, as the weather gets colder, are there any trends that we're going to expect to see in regards to cases over the winter time? Do you think it's going to get worse or better, or what do you think is going to happen?
I think that we need to have some guarded optimism. We do know that a few things have changed. Number one, you're right, we're coming into respiratory virus season, not just coronavirus, but also influenza, parainfluenza, respiratory syncytial virus, and so many more. It's just what happens every winter because these viruses like the conditions of the cold. They like the fact that people are gathering more indoors in more crowded kind of situations. There also has been some relaxation of some of the public health measures for gathering, and that's based on the fact that we're getting more people immunized. And I think what we gain, one of the things we gain from being immunized is we are able to relax some of those things, but it still remains to be seen what will happen. I know Dr. Moore is a great colleague of mine. I've known him for a number of years now, and I think we're on the same wavelength in saying that let's hope for the best, but be prepared for anything that could happen. Look what's happened in New Brunswick, where they were doing terrifically well for so many months, and then all of a sudden, for reasons that I think are not yet clear, the virus just did what viruses do, which is when they see a chance to infect a vulnerable population, they go for it. Same in Alberta. Now, I think things are starting to get better in Alberta, but with this virus and knowing that we still have all those younger kids still susceptible, and that 15% of the eligible population who has not accepted the vaccine, we still have a large proportion of the population that's susceptible. And this virus will do what viruses do, which is spread. This is absolutely essential for their survival as an organism. So they will do that, and we have to be on our guard. So let's hope that things will be better. I'm pretty sure that we will see a better winter than last year from the point of view of the fact that so many people are immunized, but there's still too many people out there unimmunized. And so I think it's still possible for this virus to circulate. And that's why I think caution is the best approach until we have decided we've got this thing into an endemic or controlled form. Thank you.
Last question for me, just in regards to vaccination rates. Does it look like at some point we have stalled out, or we're going to stall out in getting people vaccinated? And what efforts are we making to kind of encourage people who may be hesitant to get the vaccine?
Well, Donna may want to comment on this as well. I guess from my point of view, I think that there's been a provincial strategy called the last mile, when let's really do our very level best to get people who are hesitant. Let's hope that some of the measures that would encourage people to be immunized, because it gives them more freedoms, lets them come out of lockdown as such, for example, to be able to go to restaurants and movie theaters and that kind of thing, for all these reasons. But you are right that whereas when the vaccine was first available, there were way too many people who all wanted it on the same day, to now where we are really working hard to convince the hesitant to come forward. I am hopeful that we will be able to get this up over 90%, as has happened in some parts of Ontario. You may be aware that in Leeds, Grenville, Lanark area of Eastern Ontario, they are well above 90% in terms of their uptake of vaccine by the eligible population. So let's not give up. And with your help, getting the message out there about the value of it, the benefits of being immunized, not only in terms of health, but also in terms of more abilities to do things that people want to do. Let's hope that this will continue. And as you heard Donna say, the people who want their first or second doses of vaccine are still able to come along and get it. So that's, I think, all I have to say on this point, but perhaps there's more that, Donna, I don't know if you want to add anything to that.
Just one thing that I might add, that as we are going to offer booster doses, we'll be going back to locations in the county. Right now, the only locations that we are offering the first and second doses, or primarily it's at the Healthy Planet Arena. So going out to the county and other lower tier municipalities, there will be an opportunity for those who are not immunized in those areas to gain access to their first and or second dose again. So those types of strategies around access and continued opportunities to speak with professionals. If you have questions, continuing to look at the information that's on our website or other websites that are credible, have credible information. Those are some of the strategies that we continue to use. But yes, there is a gradual decline in the number of people who are attending the clinics for first and second doses.
Thank you, Donna. And if I could just pick up on that, we are soon to launch a radio and digital marketing campaign promoting the consultation services that are available. We know that many who are vaccine hesitant often just need an opportunity to speak with a healthcare professional about their questions regarding the vaccine. And so we've created a dedicated URL, and I'll put it in the chat thread, but it's basically peterboroughpublichealth.ca/consultation. And there people can access information about two sources. There's ways of speaking directly with a physician. You can book an appointment with a physician through the Scarborough Health Network and talk to a physician with your health questions. There's also an opportunity, and I think for parents, this might be particularly of interest, to speak to a pediatric nurse from Sick Kids Hospital. So the links to where you can book appointments to have those conversations with these credible healthcare professionals are available on our website, and we're going to be promoting those quite actively in the next couple of weeks. So hopefully that helps as well.
All right, excellent. Thank you all so much for helping. I appreciate that. That's all for me. Thank you.
Great. Oh, and I see Carrie's already done that. Thank you, Carrie, and thank you, Taylor, for your question. I also, because of my ever responsive colleagues, I'm able to provide the date of the last death that was reported on September 10th. So hopefully that helps with that information. Okay, so last but definitely not least, we have Paul Rellinger. So Paul, if you've got some questions for our speakers, please go right ahead.
I do, actually for Dr. Gemmell, and if I could, Julie Ingram after that. Dr. Gemmell, I just wanted to clarify, for these booster shots in all categories that you mentioned, it's a 6 month after your second shot, correct?
Yes. We're lucky we have a National Advisory Committee on Immunization that looks at all the literature published, not just before the vaccine is licensed, but also the literature that is published observing how the vaccine works in populations. And it looks like the earliest that a vaccine booster would be needed would be at 6 months. So that's the time frame that has been chosen.
Okay, all right. I just wanted to clarify that because I know probably when it's open up and appointments are taken, you're going to get some people who probably may have got it just 3-4 months ago, right? So,
right, and those folks, while they are eligible, for example, I'm an example of somebody who has had 2 doses of vaccine. My last dose was administered on the 17th of June, so I would not be eligible until at least the 17th of December. So to just give you kind of show how that works for an individual.
Okay. And the other question I had is around AstraZeneca. Now, if we go back through the course of the pandemic, when questions have been raised about the effectiveness of vaccines, it seems AstraZeneca is the one that comes up all the time. And I guess what I'm looking from you for is some reassurance to those who got AstraZeneca that it's effective. They needn't have to worry because again, with these booster shots, right? The only one that's really being mentioned again in terms of an actual vaccine is AstraZeneca, and it just seems whenever there's a cloud over any of the vaccines, AstraZeneca seems to be the one that's clouded. And I guess I'm just looking again from some reassurance from you that people got AstraZeneca don't have to worry?
Well, thanks for the question because I think it's an important one. I got AstraZeneca early on because it was available. It was one that I was eligible for, and I was just really happy to get it. We know that 2 doses of AstraZeneca is pretty darn good in terms of its protection, up to over 80%. But we also know that while we have a pretty darn good vaccine in AstraZeneca, and Janssen is also uses the same technology as the AstraZeneca, so they're both together in this. Anybody who's received either of those vaccines can get a booster. We do know the mRNA, not only are they pretty darn good vaccines, they're amazing vaccines because they give us even higher levels of protection. We further know that if someone has had a dose of AstraZeneca and enough time has gone by that they get a dose of mRNA vaccine, that gives them it may even be the best combination of vaccines. That needs to be worked out, but that will, I hope, give people a reassurance that if they've had 2 doses of AZ, they have pretty darn good protection. But when they get that third dose, and it'll be an mRNA vaccine, they are actually going to have amazing protection. So yeah, Astra and Janssen, they use a different technology. It involves an extra step in terms of the production of the proteins by that the immune system needs and reacts to in our bodies. And for whatever reason, I think we probably don't clearly understand it yet. These vaccines don't have exactly the same effectiveness as the mRNA vaccines, but they're not vaccines that are useless by any means. They are really good vaccines, and with an additional dose, a booster dose of a mRNA vaccine to all these folks, that's people who've had 2 doses of Astra or even a single dose of Janssen, they're going to have great protection. Thanks.
Okay. Thanks so much, Dr. Gemmell. That really, I think that'll reassure people for sure. So thank you for that. For Julie Ingram, if Julie's on the call, I was just looking for hopefully some kind of update on any enforcement or anything that's been going on. I know last time we talked 2 weeks ago, you were watching one particular business still, and I'm just wondering how things have been rolling out the last couple of weeks in terms of enforcement.
Yeah, thanks for the question, Paul. Things are going well, I would say overall. What I'm really pleased with is a lot of premises that we've done secret dining at have been fully compliant. So that is really reassuring to me. Premises are doing their proof of vaccine checks and doing the proof of identification checks. There's always room to improve. Of course, we're still seeing some gaps in specifically active screening and a little bit in the contact tracing pieces and the record keeping, but the proof of vaccine is going quite well. So first and foremost, I really want to express my thanks and gratitude to businesses who are taking the time to do that. We know it's not easy, and we know it can be a pain, but it is exceptionally important that those activities continue, especially now with the increased incapacity limits. Excuse me. When you start to go out to say a food premises, or if you are attending a meeting, that's a facility that has proof of vaccine that now has the luxury of having the full capacities. So it's going to feel unsettling. So that's where the proof of vaccine becomes just so important. So I'm really pleased that we're seeing that. And regarding other enforcement actions, since the last media scrum, we have laid charges on 2 additional food premises where they weren't so successful with the secret dining activities, and proof of vaccine was not confirmed. So we have taken action on those, and the other business is still ongoing. So we'll probably be able to update about that soon, but there's still issues with compliance there.
Thank you. And when you say taking action against those 2 other businesses, is that in the form of fines, or what was the action?
Yeah, they have both received tickets. Yes.
And they were food establishments?
Yeah, they were both food premises. Yeah. And that information is available on our website as well. I can throw the link in the chat too.
That'd be great. Thank you. Just one more thing, Julie. Like anything else that's new, when the vaccine certificate was first required, you know, there was a lot of education and people had to get used to it, and not only patrons, but certainly business owners as well. Are we past that stage now? Do you feel that people are kind of in the swing of things and this is becoming more a norm that they're kind of getting used to?
I would say, Paul, yes, I do think that is the case. I think that this is becoming more normalized with patrons who are attending facilities, and it's certainly becoming more normalized with our local businesses. We're 6 weeks into this requirement now. So while there was a time and a place for, you know, continuous education and warnings within the first several weeks, I think we're starting to get to the point that we are past that, and just like COVID-19 safety plans, it's an expectation. Proof of vaccine is an expectation, and it's your responsibility as a business owner to know if those requirements apply to you or not. We do our best to communicate out through our website and targeted messaging as well. But yeah, I think it is becoming normal, and I think that we're seeing evidence of that through the successful test shops that we're seeing as well.
Perfect, Julie. Thanks so much. And that's it for me, Brittany.
Great, thank you both very much. And I'll just circle back quickly to Donna, who had her hand up earlier. Was there anything you needed to add, Donna? Or are you good?
I just wanted to clarify that for boosters, for those residents in long-term care homes and retirement homes, the eligibility criteria was 5 months rather than 6 months. So it's a little bit of an oddity, but for everybody moving forward, as of the announcement yesterday, it's 6 months.
Great. Thank you very much, Donna. Okay, well, I think that brings us to an end. I did receive a follow-up from Global News that they ran into some technical issues, so are not able to join us today. But for everyone on the line, we do post videos of these media briefings on our YouTube channel, and that will be up before the end of the business day. So for reference, you can always access them that way. Thank you again all for joining us and for your good questions and your good information. And we will look forward to seeing you in 2 weeks' time. Thanks. Stay safe out there.
All right. Thanks, everybody.
Thank you.
Thank
Thanks for
you.
coming. Bye.